It doesn't take patience at all to talk to somebody intelligent and brave and honorable. It inspires me. Thank you, David.
I'm so fighting because I'm like, I know what I want to say and I want to say it, and I'm like,
yes,
now words pissing me off.
You've got it all in there, and just the minute you're relaxed, it flows out all the time when you relax.
Exactly. I'm like, if I'm calm, just casual talk is like, fine, cool, good.
Yes, it is. It is. And I could see it there, and it would just come in a lovely burst. But I really enjoyed it, and we'll do it again at some point as well. But this article is seminal. It is absolutely key. No, well done.
It's a big hammer.
It really is.
You know, when you get an mRNA vaccine, you're obviously expecting to get mRNA. But what else might be in that vial? Well, today we're going to break down a fascinating study by Speicher and his colleagues that took a deep dive into the Pfizer and Moderna vaccines to answer that very question. Okay, so before we can really get into what the researchers found, we first got to understand how these vaccines are supposed to be made. It all boils down to a pretty straightforward 4-step manufacturing plan. All right, so it all kicks off with a circular piece of DNA called a plasmid. Just think of that as the master blueprint. Then an enzyme comes along and makes a working copy, the mRNA, from that blueprint. Now here's the part that's absolutely crucial for this discussion, step 3. The original DNA blueprint is supposed to be completely taken out, gone. Finally, that finished mRNA gets tucked into a tiny fat bubble, the LNP, for delivery. And that removal step, that is exactly what this research is all about. So yeah, that brings us right to the heart of the study's main question. After that cleanup step, how much of that original DNA blueprint is actually left floating around in the vial? And what they found? Well, it turned into a real manufacturing puzzle. To measure this leftover DNA, the researchers used 2 different scientific tools. First up is qPCR. You can think of this one like a super specific search engine. It only looks for and counts particular DNA sequences that you tell it to find. The second method, fluorimetry, is more like a scale. It just weighs the total amount of all the DNA in the sample. Doesn't matter what the sequence is, it weighs the whole shebang. And as you're about to see, these 2 methods told 2 wildly different stories. Now check this out. When they used qPCR, the search engine, everything looked pretty much okay. As you can see here, the Moderna samples, way under the regulatory limit. Most of the Pfizer vials were either under or right around that limit too. There were only a couple of Pfizer lots that were a bit over, and that was just for one specific DNA sequence they were looking for. So far, so good, right? But then they switched to the scale, the tool that measures all of the DNA. And this is where the picture just completely flipped. The paper reports that every single vial they tested, both Pfizer and Moderna, was way, way over that same 10 nanogram limit. All of a sudden, nothing was under the guideline. And look, we're not talking about just squeaking by here. The highest level they reported finding was in a Moderna vial, a whopping 627 times over the guideline. According to their results, the vials they checked had anywhere from 36 to 627 times more leftover DNA than the recommended limit. But the investigation didn't stop with just the amount of DNA. The researchers also wanted to know, what kind of DNA was in there. And when they took a closer look, one specific sequence really jumped out at them, but they only found it in the Pfizer vials. They found a DNA fragment called the SV40 promoter enhancer. The easiest way to think about it is like a key and a delivery truck all in one. The paper notes this sequence is really good at unlocking genes to switch them on, and it's also known for helping shuttle DNA cargo right into the nucleus of a cell, which is, the mission control for all of our genetics. And because of those functions, the authors, they don't mince words. They state right in the paper that finding this sequence raises what they call significant safety concerns. So this brings us to the real core of the author's argument. It's not just about the numbers on a chart. It's about why they believe these findings, both the huge quantity of total DNA and the presence of these functional bits like SV40, are a big deal when it comes to safety. You see, the current safety limit, 10 nanograms of DNA per dose, it's been around for a while. But the authors of this paper argue that this standard was really created for older vaccines, where any leftover DNA would just be naked, and our bodies would break it down almost instantly. The author's main concern here is that lipid nanoparticle, that little fat bubble. They're basically saying the old safety limit was for naked DNA that doesn't last long, but in this case, the DNA is wrapped up in a protective bubble. And they note that this bubble not only shields the DNA from being destroyed, but it can make it up to 100 times easier for it to slip inside our cells. On top of that, they point out that the old guideline doesn't really consider things like multiple booster shots or whether the DNA in question has a specific job to do, like that SV40 sequence. Then, the authors did something pretty interesting, a kind of preliminary analysis. They took the vaccine lots they tested and cross-referenced them with public data on reported adverse events in Canada. So, for example, as you can see here, they note that a couple of the Pfizer lots that had the highest SV40 levels also happened to have high rates of serious adverse event reports in that public database. Okay, now this next point is absolutely crucial, so I want to be crystal clear. The authors themselves state very plainly that this part of their study is just exploratory. It's preliminary. They say their sample size is small and that a lot more research would need to be done to figure out if there's any real confirmed link there. So after all is said and done, after all the measurements and all the analysis, what's the final takeaway? What's the bottom line from the Speicher et al. Paper? It really comes down to 4 main points. First, based on their scale method, all the vials they tested were over the limit for total DNA. Second, with their search engine method, a few Pfizer lots were over the limit for that specific SV40 sequence. Third, they saw a lot of variation between different vaccine lots, which to them suggests an inconsistent manufacturing process. And finally, and this is a big one, they make a direct call for regulators to go back and reevaluate the DNA guidelines, specifically for these new LNP delivery technologies. So really, when you step back, this paper is about more than just numbers and vials. It's asking a pretty fundamental question. As our medical technology leaps forward, are our safety regulations keeping pace? This research seems to suggest that's a question we really need to answer, and probably sooner rather than later.
Dr. David Speicher, I have been wanting to talk to you for a while. You've come highly recommended from several New Zealanders that I know, and I know that you did your PhD in Australia at Griffith University, so you have strong links down under. Beyond that, you describe yourself as a Canadian molecular virologist. You're based in Ottawa, and if you like, your seminal motivation is, this is what you told me. You are against any medical device or procedure or drug that is forced on people, which causes people harm. And as you said to me, it's about doing things the right way. Welcome, Dr. David. It's a real honor to talk to you.
Thanks. It's such a delight to be here.
It's
Liz.
wonderful. And you have done absolutely exceptional work. I could quote a number of papers. You work often with Jessica Rose, another widely admired researcher who has fastidious standards, as you have, and with Kevin McKinnon, whom I know because when we put up the Barry Young data in the early days, and we knew it was fully anonymized, we had gone right to the top. We'd spoken to RFKJ as part of that, spoken to 2 of his leading epidemiologists, spoken to Professor Norman Fenton in the UK and Andrew Bridgen, and researched for 8 weeks to make sure that it was what we were saying it was. We heard that Kevin McKinnon tried to download that fully anonymized data and he lost his whole database. You work with Kevin. That is not just an urban myth, that story. That is what happened, isn't it?
Yep. Yeah, it's exactly what occurred, and it's been so long that I almost forgot it. So
he is the perfect whistleblower. There is no other way you could describe this man. He's working for the government. He sees a crime unfolding. He sees New Zealanders like Rory Nairn, a young builder, dying prematurely. He sees many other excess deaths above the normal rate. He reports it. He lets every politician in New Zealand know on the day that he puts this out. He gives everybody warning that he is putting out evidence of a crime. And instead, the government goes after people like Kevin McKinnon and silences them in America. and goes after everybody around the world and spends over $3 million, we believe, trying to silence
Yep.
people. So I would say to you and Kevin and Jessica Rose, once he is declared a whistleblower, I pray that he is, we'd love to get that fully anonymized data over to you, because there has not been one name of one New Zealander revealed. But it was real bullying. You have had the same. Now let's talk about your article, an article that you call The Hammer. It was presented in April of 2025, and it took till September before they put it out. Tell us about this article, which goes under the formidable title of, I'll just read this out. Incredible that you largely wrote this, I gather, and then worked with Jessica and Kevin. It's called The Quantification of Residual Plasmid DNA and SV40 Promoter Enhancer Sequences in Pfizer BioNTech and Moderna mRNA COVID-19 vaccines from Ontario, Canada. Are you the primary source of this information, this crucial information in the Hammer article, as you call it?
It's a definite team effort.
Yes.
In April of 23, Kevin first found the DNA and the SV40 and was told that, it's lab contamination, small sample size. And so I was given 32 vials here in Canada, and I looked at those with both PCR and fluorometry. I basically repeated Kevin's work, and I found DNA and the SV40 in those. So all of the vials contain large amounts of DNA contamination. Only Pfizer vials contain the SV40 promoter enhancer sequence.
This is really key. So every vial you looked at of Pfizer and Moderna vials showed DNA contamination.
High amounts of DNA.
Just tell somebody who's completely non-science focused, orientated, somebody who has put these in their bodies, what is the implication of that?
We all think, it's just DNA. It's basically no big deal, and we're told as well off of the health authorities, such as the TGA in Australia, that it's fragmented and it's non-bioactive, and therefore it's no big deal. Well, this is not just naked DNA. This is large amounts of DNA packaged inside lipid nanoparticles being inserted into our cells. Okay.
Wow. Large amounts of DNA inserted inside lipid nanoparticles, then inserted inside our cells. I need to repeat that because a friend of mine paid a fortune to go to a specialist before she took the jabs. She said, don't worry about it. It goes into your arm for a day or so, into the muscles, and then it's expelled by the body. I mean, it was such fake science. It's fake medicine that she was given by this specialist.
We're basically told several things. We're told it remains in the arm.
Yes.
False. It goes throughout. It affects the heart. It's found in breast milk. In mice studied within hours, lipid nanoparticles are found in mice fetuses. So
Oof.
no, it doesn't stay at the site. We're all so informed. It just contains mRNA in a lipid nanoparticle. False. It's also a lot of DNA
Wow.
in there. It will enter our nucleus. It's not just non-bioactive fragment and DNA, and the Pfizer plasmid used in the vaccine is a DNA plasmid directly out of Pfizer's Department of Gene Therapy.
Oh, and this is real science. This is science where you have delved in and done the due diligence, which was not done by Pfizer or Moderna. I looked everywhere for a family member who was about to have a baby. Where are the studies on whether it gets into breast milk? Where are the studies on whether it affects a baby in utero? There
Yeah.
was no study I could find in 2022, David. I mean,
I
anybody who
am
cares about
a
the future of the human race should feel furious, absolutely furious at this. What were you going to say?
I am a facts-based scientist. Okay, I don't make up things. I don't hide the facts. I took the vaccine vials. I tested in this paper 32 Canadian vials myself, and these are the facts and the results that I found. So take them, test them, and that's it. I don't change things to suit someone's agenda.
Just as an aside, did you have to be very careful taking that material out of these vials to test it? Because I have heard of people here in New Zealand who tried to do that and became quite sick. Did you have to take, that the material in the vials used in the jabs is not
No,
something I would want to put deep inside my veins, but it didn't make you sick?
no, and
Mm.
that's how come in the lab. I'm fully lab coat, gloves,
Ah, you took the
goggles,
precautions.
because I want to ensure that none of this gets in me. I've looked at these, and these that vaccines are both safe and effective. They are basically safe in the vials and effective at causing people harm.
Effective at causing people harm. I mean, that safe in the vials and effective at causing people harm if they get out. I mean, doesn't that sum it up? The politicians forgot to tell us the rest of the lines they were using.
Oh yeah,
Yeah.
yeah. It's
This
like,
is
is it safe if you don't touch
touch
it?
it.
Sure.
It's safe if you don't let it get near the inside of your body, your your
Yeah.
your your venous system, your blood system. This is horrific. Let's go back to your article. Why did you give it the nickname the hammer? I mean, I already can surmise, but let's see what your reasons are.
So, we've been told since it was first out as a free print in September of 23 that it's not out, it's not peer reviewed. It's been now peer reviewed, published, and it's on PubMed, fully owned access, and two, there's enough data in this to show Pfizer and Moderna have done scientific fraud, and it can bring the whole
Thing down.
thing down.
So, David, I know that you've given it the nickname the hammer, this article, and having seen it and having seen the explosive information that is in it, the truth that is in it, I can surmise why you've given it that name, but you tell us why you call this article the hammer.
So I've called it that as it's enough work. It's the actual factual facts of the DNA contamination in the nation and the SV40, and it's enough data to bring the whole system down.
Wow.
And it is now been peer reviewed. It's on PubMed, and therefore it's a very powerful piece in multiple court cases, because until this point where we're told, oh, it's a Substack article or a pre-print, and it's not actual peer reviewed science. Well, it's now been there. It's now on PubMed, and it is fully open access. And unlike Pfizer, this data isn't being buried for 75 years.
Beyond that, it's making a real impact. If we have a look at it's in the top 5% of all scientific papers that are tracked. So I think the number of scientific papers being tracked is around 29, nearly 30 million scientific papers. And your paper here is number 3,437 out of nearly 30 million scientific papers that are being tracked online. I mean, that tells you a lot of very serious scientists are taking this information very seriously. What has the feedback been like? What was it like when it? Because perhaps before we talk about that, why was it held back from? You submitted in April, and it's not published until September. What was that hold up about, and is that typical?
It's a very rigorous peer review. One of the reviewers was very adamant that our work wasn't right, and he questioned things very in depth, and we, in a 22-page response, answered things, answered all of their questions and concerns, and our main point is that all of this can cause harm. These are our findings. It needs to be reproduced and looked at, and so it's a clear sign that further work into this needs to be looked at, and it's important. And just just like SV40 was not disclosed to the regulators at all. It shows there's key things here which are not right and needs to be looked into.
It's
So on that point, we know spike is toxic. LNPs are toxic.
that's lipid nanoparticles are toxic. Yep.
Yeah.
Spike is
on
toxic.
their own. There's SV40 promoter there, which will knock out the P53 and turn cells cancerous. There's a SV40 enhancer there. There is a SV40 enhancer sequence on that plasmid. So it's been known since 1999. David Dean's work. If you take a DNA fragment attached to a SV40 enhancer, inject 3 to 10 of those into a non-dividing cell, which has an intact nuclear envelope, it will move into the nucleus and integrate into the genome of that cell. And Pfizer has known this since 1999 and has used this against us.
What possible reason could Pfizer give to justify putting this, as it's called, SV40 promoter enhancer in your paper? This is what you write. The presence of SV40 element in Pfizer raises significant safety concerns. So have I said that right, David? The SV40 promoter enhancer, and it was only in the Pfizer vials that you looked at. It wasn't in the Moderna vials. Am I correct there?
It's in all of the Pfizer vials.
Yes.
I have looked at it in Canada, Australia, and Ireland.
Wow. Did you look at any New Zealand vials?
No. I have offered to. I have yet to receive any to look at.
There's an offer. And, you know, one of the things in New Zealand, I haven't followed closely Ireland, Canada, and Australia on this, but in New Zealand, we have massive numbers of people with what's been called turbo cancer in a sort of nonchalant way. Before the rollout of these jabs, we'd never heard of a thing called turbo cancer. The numbers of New Zealanders, I mean, we had a group called the Top Twins, two beloved sisters, and they both got their cancers back. The number of New Zealanders whose cancer was arrested earlier, perhaps, you know, in the years before the COVID pandemic, and their cancer came rushing back once they'd had their jabs. But this is not being discussed at all. This is not being discussed in mainstream media. What is the SV40 exactly? Why would they have done it? Back to my question. How could they justify it?
So SV40 is simian virus 4T, and it was first found in the polio vaccine, and was found there to cause cancer. Now this time you've got a enhancer sequence. You've got DNA that is injected right into our cells, and all of these things can cause our cells not to function right. So the lipid nanoparticles spike. There's RNA, the DNA hybrids. So the more we look at these vaccines, the more ways in which we find they cause harm.
It's incredible. This is the
It's
hardest.
insane.
It's insane. It's also the hardest part for the so-called normies. I mean, I was a normie. I was just getting on with my life. I was thinking the government was very imperfect and often incompetent, but I never realized until the last 5 years how malevolent governments can be. A government that is sold out to a much different agenda from answering to the people, which is what all our Western governments have now sold out to a globalist agenda 2030, to the WEF, to the UN, to Gates' ideas of reducing population. That
Oh yeah.
you have to actually, all the evidence points us in this direction, and you have to come to terms with the fact my government is wanting to hurt me and my family. And this is where your science-based approach underscores that. It gives evidence. Because can this be explained in any way that could be interpreted as benign? Could Pfizer come back and say, no, the SV40 is very good for health? Is there any way they could argue that in a court of law?
Not at all. No.
That
It's
there's the hammer. There's the
it's
hammer.
Yeah. It's a very difficult thing. I think a lot of normies, as you've said, are like, well, it's basically over, it's gone, it's done with, so just
Move on. Not
move on.
not
Well,
what I can do.
a lot of these are blinders on. They're like, it's behind, it's done, let's just move on. Well, if you are vaccine injured, or if your son, mom, wife has been harmed or killed by these shots, your life has been changed forever. So we can't just move on. We must ensure the facts are there, the facts are known, and that a travesty like this never happens again.
The amount of the SV40 in these Pfizer shots used for children's vaccines is the same as the amount that's used in adults as well. So it's not
the
only that we've
exact,
got, yeah,
it's the exact same levels in kids as it is in adults.
that is just, I mean, it is so clear at that point that they do not care about our children, that they do not care about us, those who are manufacturing and pushing these poison shots. Because if it brings on cancers, then it's only a small step to look at our countries and say, what are the rates of cancers in our children right now compared with prior to the COVID pandemic? Are you
Yeah.
aware of scientific studies comparing pre-pandemic, pandemic to
Yep.
cancer rates now?
Yes. The cloud here in Canada just published such work, and cancer rates of all ages is going up.
What has been the reaction, A, within the scientific community to this article, and secondly, what has been the penetration of your article out to the mums and dads who are trying to work out, do I trust my government? Are they telling me the truth? What do I do?
If you're a government, you've turn a blind eye. It's there. There's been called to halt here in Canada, the David Declaration in Australia and the North Group in Europe. And basically, the government response is to ignore it. It's not right, and hope it goes away. Hey, if you're like us, and you see it, you're thankful that it's out. It's peer reviewed. If you're a normal physician that's typically on their job doing their own thing, they're completely oblivious to things like this. I have sent this to several physicians who've looked at it and said it's evidence-based, balanced, clear. And did they agree? Did they've seen things change in time? They can't say a thing. If they do, they're sidelined, canceled, licensed. And so a lot of them just keep to their own lane, find there's on, and yeah, we need the world as a whole to wake up.
Absolutely.
And see the facts, and to say enough is enough.
And we talked about the Barry Young data in New Zealand that showed the pay per dose, the money that, for example, pharmacists around New Zealand have made, millions, let alone doctors.
Millions.
But at some point, these doctors and pharmacists and all these people who are part of this need to go, this money is not enough. My people around me are dying. My people around me, my own race, are getting cancers in vast numbers. The scientific evidence is in of the dangers of the cavalier attitude, of the actually worse than cavalier, criminal attitudes of these. Pfizer was already a company that had had much criminal condemnation in the criminal courts for prior activities in which they had not behaved honorably. And these people who are part of pushing and promoting still their products need to at some point say enough. I'll look at this article, which we'll put below this interview. I will honor the work of these scientists. I will demand that my government pulls these down. Is that what you would most like to see? The ending of the mRNA platform? The ending of this pseudoscience that has been shown not only to be not properly researched, but highly dangerous for humans?
Yes, these are not vaccines at all. This is gene therapy, and it needs to be looked at, pulled. Yeah. Enough have been harmed. And if you've seen, there is still a major campaign out there to get our work pulled, to ensure it is unpublished, it is retracted. And if it was some bogus science, the pharma companies would have exposed it. It'd be no big deal, ignored, and in time things would eventually go away. It is such a powerful piece. It cannot be simply ignored, and therefore their best thing is to attack the work not by factual attacks. It's called anti-vax science, which is completely an attack on character and not on the science of the work.
If you cannot debate me on the substance of what I'm saying and have an intelligent debate with me on substance, on issues, on research, on what you've looked at, if you can only resort to name calling, labeling me, being personally doing ad hominem attacks, personal attacks, then in my eyes, you have no credibility. So when I look online and I see people just calling somebody who's like you, who's doing really valid science, just calling you names, those posts they're laughable now. They're not even worth spending 1 second of our time on. The only thing we need to get back to is intelligent debate backed up by facts, which is what you're offering, David. You're offering that in this article and in many others. Where can people follow you online?
I'm on X and on Substack. I'd like to go back for 1 sec. And you asked, has this been my work? And I have looked at all of those files myself. I've examined the data. Jessica has helped with the bears analysis and has taken most of the interviews. And it's been Kevin's methods, Kevin's guidance, and he helped me write the paper. So it's been a lot of my own hard work, effort. Others have taken some of the accolades, but I stand fully behind all of the work on this, which I have done.
You're tremendously brave. I mean, even back in the beginning, right in the beginning, when you saw wrongdoing, I think you've had to sacrifice something like 5 different jobs because you've spoken up. But it was March 17, 2020, when you started questioning the virus origin. You questioned the lockdowns, which is something Dr. Jay Bhattacharya, who is now in the position of Fauci, in the new administration, he questioned that. That was what the great Barrington Declaration was all about. Do you know if this paper alone, the hammer, we'll call it parochially, do you know if that has made its way to Dr. Jay Bhattacharya, to RFKJ?
Yep. It's been on both RFK's desk, Trump's desk, Senator Ron Johnson. Well, this was put out September 6th on a Saturday. September 6th, this was published on a Saturday. On Monday, it was on both RFK's desk and Trump's desk. And on the Tuesday, Ron Johnson put this exact paper on the U.S. congressional record. And then on September 19th, CDC ACIP used this work to make changes to the policy for the COVID-19 mRNA vaccines.
This is absolutely wonderful. The last interview we put out was with Dr. Kirk Milhon and Andrew Bridgen, and Dr. Kirk is on the advisory committee for the CDC, ACIP. So, yes, this is wonderful news. These are the good people of the world now starting to move together in the right direction in which we want an honourable administration to go. And when there are enough numbers all working together, I believe it will start to really change the direction of this disaster. Really a disastrous experiment on human beings, hasn't it? It's just been a live experiment in real time. They really launched something, the implications of which they had no idea when they put it out. And beyond that, forced and coerced and one could say blackmailed if you're worried about providing for your family and you're going to lose your job and your home and everything that matters to your family. You take this poison shot against your will and then you get injured, and there was no backup for people. Let's go to your what you stand for, Dr. David. I just want to, if you could bring that up on the screen. You showed me this when we were chatting first, before we came to air. And I want to just briefly look at the larger picture.
I put it the S, and evidence clearly shows the mRNA vaccine platform is neither safe nor effective, and therefore it's important to follow both the science and the silenced. And so all of these things, from myself being fired multiple times, vaccine injuries, the convoy, to the ostriches, 400 healthy birds, November 6th, were killed off for avian flu, and Charlie Kirk. If you have facts, solid scientific facts, and stand against the world's governments, they will stop at nothing to silence you.
This is a very sobering page. If we just, I'll read it through again. The evidence clearly shows that the mRNA vaccine platform is neither safe nor effective. We must continue to follow the science and the silenced. I stand with the doctors and scientists who were silenced for standing on the facts. I stand with the vaccine injured, forced to take the shots to feed their families. I stand with the Canadian truckers who stood up for a nation against tyranny. I stand with 400 healthy ostriches killed for challenging government policy. I stand with Charlie Kirk, martyred for speaking truth to a nation. We are Charlie Kirk. SaveOurOstriches.com as well. That is a very powerful page. Did you get a great response when you put that out?
I've had some people that love it and some people which are completely against it.
The bot farms are going crazy at the moment, I think. I mean, I can't imagine a humane person not supporting that page. And it is
such a divided, fallen, broken world. And some support some parts, some are against Kirk and things, but no matter there are differences, it is people are entitled to their own thoughts and should not be forced the facts to keep their jobs, and we all must follow the scientific fact.
Absolutely. That's beautifully said. We must follow real science, which is evolving, which is questioning, which is not dogma, which is not an ideology. And when you talk about the divisions, that's all been purposefully done. That's how communist Marxist ideology is introduced on the backs of totally divided societies, often from warfare. And then they come in with their fake resolutions. We've got a universal basic income for you. We've got centralized money so that we can control your lives. You'll live in smart cities, which S for surveillance, M for monitoring. We'll take care of you. This is all a way to bring in the Agenda 2030 from the UN and the WEF so that they can totally control us. But your standing up has been so important. And I think we'll end there with you referred to it earlier, the David Declaration, which came through Russell Broadbent in Australia, a man for whom I have enormous respect. And going back to your links at university in Australia, this David Declaration does represent you because you brought this hammer to the world. And it also represents who you are, which is the David to the world's Goliath, to the scientific liars who are not representing real science. You're the David, you and Kevin and Jessica and other good scientists and doctors, of course, who are saying, no, we stand for the truth. So tell us about that David Declaration.
So last summer, I looked at 3 Australian files, and then it's such a cool thing because on June 1st, I met at Adrian McCrae and Sue Gray and Nurse Helen and Eva, and I just assumed that Adrian is just some Aussie bloke in the back of the car, no big deal. And then October 11th, 2024, the Port Hedland Council meets and discusses my research, and it went big and sent shock waves across Australia, challenged the government, and so it was Russell Broadbent had the David Declaration commission, and Robin Cosford helped to write it, and it's this whole David versus Goliath fight between the little council and the big government, little scientist and big pharma, little Australia and the world. And I'm David, and it was first told, no, it's a bad name because of the whole Israel Gaza thing, and he's like, no, it's a David and Goliath fight, and David tested the files. I didn't write it, and I'm so thankful that they named this after.
It's wonderful. And Adrian McCrae, whom you mentioned, and I can thoroughly recommend.
Wonderful guy.
He's a wonderful guy, and he's brave, and he was involved in this Port Hedland matter and worked enormously hard. I was in touch with him around that time, and I know he was putting huge hours in. But just represents that Aussie spirit, that incorrigible Aussie spirit that will not be broken by ridiculous rules that make no sense and that will question and stand up and speak the truth. We need so many more like him, like you. I'm very, very thankful. It was Nurse Helen who put me in touch with you. So very thankful to our mutual friend there as well. David, thank you so much for your work. Thank you so much for persisting through all of the challenges you've gone through. And thank you for offering hope for those of us who'd given up, frankly, on science, on the heart of science, on integrity in our science. Thank you and your co-workers, Jessica and Kevin, for continuing to put out really top-level scientific facts. And I also work with Albert Benavides. He's helped me a lot with the New Zealand data that he's recorded there. And the people around the world are looking at the data and recording it in ways that will go down for posterity, even though those who are paid by Big Pharma might be willing to lie now. Their lies will not last. Your truth will. Thank you, David Speicher.
Thank you, Liz, so much.